Hello, we are providing feedback to our supervisees, and we are the supervisors, Tara and I.
Hi, I'm Leora and I'm a supervisee.
And I'm Dakota and I'm the other supervisee.
Okay, so we are giving feedback to our supervisees on their training project. So the purpose section on their project looks really good. You identified the intervention and the function of the behavior. And the trainer qualifications, we were wondering in that section, is that enough information? Do the supervisors or the trainers, do they need more qualifications, or is what you had on the paragraph enough?
Okay, yeah, I feel like we did provide a thorough description in terms of the required qualifications. But if you did have any additional qualifications that you thought might be necessary, feel free to add them in the comments and we'll check them out and potentially add them. Thank you.
Okay. Do you want me to go next, Tara, or you want to?
Oh, do you want to do all of section 1 and then I'll do all of section 2?
Okay. All right, that's fine. So in the client/student population feedback, we like how you included medical disorders and mental health disorders. And we like how you documented the client strengths. And were there any problem behaviors with your clients? And we had a question about your sentence about the clinic works on socializing all clients, so they're able to build tolerance at different ages. We had a question about that. So the feedback is like, we understand that you're trying to say that in this sentence, but could it be worded a little bit differently? Maybe build tolerance to interacting with all age ranges and skill ranges.
Okay,
And
I like that. Yeah, I like that. We could consider changing the wording if you feel like that flows a little bit better.
Okay.
Absolutely.
And one major thing I think throughout this whole training project is making sure that you're using the new 2022 code, the ethical code. Because I think that in several sections, you guys were, some people did the new code and some people did the old code. So just make sure you go through your document and making sure that you're using the new code.
Okay, yeah, thank you for catching that. We'll go through it and make sure that everything is aligned with the new code.
Okay. Yes, so we really like how in the setting feedback, we really like how you mentioned self-evaluations in addition to having the staff feedback in your ethical codes. And again, make sure that you, in this section, make sure that you check the codes. For the training objectives feedback, nice job on the training objectives. So the question that we had here was, if staff members do not score 90% or greater within the first 3 attempts of demonstration, what happens if they are removed from implementing the intervention? Do they have the opportunity to retake the training at another time, or are they terminated or relocated to a different position?
Dakota, do you want to?
Yeah, I feel like that's a really good question that we'll have to review it, and I think we should definitely add that into there because it can go either way. So adding that in there so that trainers who are looking over this are able to see what happens if they don't get 90%. That's really good that you brought that up. And we will definitely add in there what happens if a trainer doesn't get an IOA over 90%.
Thank you, Dakota.
Thank you.
Okay, so for section 2, in the training methods overview, on the last sentence, just make sure you fill it in at the end. It was left blank. And then a very good explanation of the components of BTS. And the only question we had is there evidence to support the statements made about PSI?
Yes, I believe that the instructor did give us feedback that we had omitted some of the references. And then, so that's something that we did get feedback from, and we do need to go back in and add those in-text citations and references. Thank you for catching that.
Okay, so then in the PSI section, some of our comments just relate to what I just said about the having the backup for that as far as evidence. We really liked how you tied in staff training and how PSIs can be helpful tools to use in both settings. And we really liked how you used ethics code 4.08 because it relates back to PSIs. And the only other critique was a little unclear on how the scope of competence relates to PSIs, and would you be able to expand on that more?
Yeah, definitely. I feel like a lot of BCBAs might not have specific, or BCBAs or any trainers in general for that matter, may not have a specific or ample experience with PSIs. So just increasing their scope of competence and making sure that they know background information on PSIs and just how to use them before using the method to train others with it.
Okay.
Did that answer your question?
Yes.
Okay, great.
For your video and the modeling feedback, there was just a couple of questions on the targeted audience would be the direct care staff. And we just couldn't see the materials in the video. So we weren't sure if that was something that direct care would have to be able to see to get the point of the video, or if it wasn't necessary for them to be able to see the materials.
No, I think you definitely make a good point there. I do think that the materials should be in the video. The video that we provided didn't, but we will definitely consider remaking the video with the materials in there so that trainers are able to see it and know clearly what to do.
Great job with the scenarios, though. It was really easy to follow along in the video.
Thank you.
So then for the role play section, the feedback there was just where you talked about the review of 22 studies conducted by Vandermeer and colleagues. Is there data to show the positive outcomes of role play in those studies?
Yeah, there is some data that shows it. It didn't directly go with what we were talking about, and so we didn't add it in there. But we'll consider adding it in there if you think that it is necessary to show both sides.
Okay. Excellent job with the ethics codes on there. And then the only other thing was when you talk about the study shows 90 to 100% of mastered components, which further provides evidence. The feedback there was that we really liked how you're giving data to show the percentage of mastered components. But would you be able to add in what the baseline was prior to role play and then showing how much the staff improved?
Yeah, I think it would be, now that you mentioned that, really good to add in the baseline. I don't know it off the top of my head without looking at the article, but I do think that would be a great idea to add the baseline so that we can see how much progress was increased because of the role play. That's a really good idea.
So for coaching and feedback, we thought you had a really clear and concise summary of the literature supporting coaching and feedback. There was one sentence. It was the studies conducted by Sheeler et al. 2018 show that coaching and feedback can be administered in various ways for increasing behavior. It was at the end of the paragraph. The only suggestion, you may want to consider putting that like at the very beginning as like an introductory sentence, and then listing the studies that support it. Use that more as like an opening line. But excellent job using data to support the use of coaching feedback. And then the only other thing for that section was the reference to capitalize the first letter of the title for the Wilczynski article.
Thank you.
Training acceptability, great job explaining all of the evidence-based practices used in the training. And then you'll see in the comments, there was just a couple of spaces where we thought maybe you could break it up into separate paragraphs to have it flow easier. But otherwise, It was a great section, and just make sure to delete the directions at the end of the section that come right before the ethics part.
Sounds good. We will do that. Thank you.
And the last part for section 2 was the training timeline. So nice job with all the equipment needed. It was really detailed and easy to follow. And the only question is, do you think 1 day is enough time for the training?
That's a good question. I think that we had made the training schedule before getting started on the materials, and you do bring up a good point that it is a lot of materials. So we'll consider reviewing and deciding whether we should split it up over the course of 2 days.
All right, so section 3. We loved how you mentioned ABC data, but then we would ask that you add a little additional types of data that can be used to determine the behavior's function. It's very important in this section to define what is functional behavior analysis in this section, and expand to make sure that there's a difference between functional behavioral analysis and what a functional analysis is, because it wasn't clear in this section which one you were talking about.
Okay, so we will go back in and clarify that. Thank you.
And then you gave really great examples of escape maintain behaviors. And here, just make sure that you include information about how supervisors decide between a DRL and a non-contingent reinforcement in this section of the function-based interventions. And then great job on the ethics codes in this section.
Thank you.
Overview of the DRL feedback. It says you made a sentence that says during an interval DRL, the practitioner splits the complete session into a series of equal time intervals. And it's a great explanation of the intervals, but also give an example for like 30-minute section can be broken down into like 6 or 5 intervals.
Okay.
And then for the next one, the sentence here is to reach the desired end rate of response, practitioners should gradually thin the DRL schedule. It's a great job mentioning the importance of gradually thinning the DRL. And if it's thinned too quickly, it can result in a ratio strain. And in this section, I guess there's some alignment that needs to be fixed in this section.
Okay.
That could also be because it was in a PDF and then we uploaded it to Google Docs. So I don't know
Okay.
if the formatting is because we put it on Google Docs and it like switched between a PDF and Word.
It actually, I believe it's because the rule 1 and rule 2 in this section were direct quotes from the Cooper book. And so instead of using the quotations, because it was such a big quote, we did a block quote, and that's why the indentation is in. But we'll double check the APA manual to make sure that's the correct formatting. And if not, we will put it back on track and use the direct quote. So thank you for pointing this out. We'll definitely check it out to see if it's in the correct APA formatting.
So the last part in this section is choosing between a DRL and a non-contingent reinforcement. Wonderful job explaining why supervisors choose specific interventions, and nice job giving specific examples of ableistic language, and great job describing the difference between NCR and DRL. Well, we have a question about if you're targeting an escape maintain behavior. We asked that if we are truly targeting this behavior, is it truly beneficial to the individual if it is implemented to have a person fit a specific standard? So they said that it was an excellent point, and we glad that you included it in here. Sorry, I read that wrong.
That's
I
it.
apologize.
Thank you. No worries.
Yep.
We're only human.
And then, okay, your turn, Tara.
Oh, you're muted, Tara.
I know, I'm sorry. I was talking to my son.
Okay.
All right, so for section 4, the vocabulary, In the ableism definition, it said directed towards those with physical and intellectual. I think you just have to add in the word disabilities before the word that.
Oh, absolutely. That was a typo. Thank you so much for catching that.
For the behavior definition, we thought maybe you'd want to consider adding in that behavior is observable and measurable, and maybe talking about the dead man's test.
Yes.
That would be a great idea.
We thought it might be helpful to add in the functional behavior analysis definition and then a functional analysis to the vocabulary list. And then for your schedules, to just write out the full name. So fixed ratio instead of FR, or just put it in quotes. For your client outcome feedbacks, again, just double check that it's the new ethics codes. And make sure that you take out the instructions at the bottom from the professor. And we liked how you stated that they need the word no in their repertoire, but it needs to be decreased during verbal protests.
Mhm.
And then for the references, there's just some comments on there for fixing the references to APA format.
Thank you.
Thank you.
Okay, so section 5, we have some questions about your knowledge acquisition pre and post test. For question 1, is it possible for them to know the answer to this in the pre-test? For question 3, are these data collection procedures only for your specific training? And it said this may be confusing if they are supposed to take different data on the same behaviors in the future. For question number 6, make answers A and B a little longer so they're about the length of the correct answer.
Okay.
And nice job including a wide range of questions and varying your correct letter answers.
Thank you. We will definitely implement all of that feedback and revise our acquisition test accordingly.
For the modeling feedback, nice job outlining the 4 types of video modeling. We liked how in your article you talked about the generalization that it wasn't a diverse population, and it would be hard to generalize that study to, like, you know, the school setting. For the role playing feedback, nice job referring back to the literature review. And we really liked your scenarios. However, scenarios 1 and 2 seem a little similar, and they seem to be in the same type of setting. It would be beneficial if they could, you could role play with different target behaviors in various settings.
Okay.
In your scenario number 2, why is it when they're only asked to play board games? What happens if his peers do not ask him to play board games and ask him to play like cards or blocks?
Okay, I think we use that as a general example, but we can clarify that there could be multiple antecedents.
Okay. And then when modeling is shown to the staff, the trainer will have staff break up into groups of 3. So it's like how many trainees are needed for each scenario.
Okay.
It looks like like scenario 2 needs to have 3 staff to participate in the role play, but it's only 3 people in the group who is collecting the data.
Okay.
And then when listing the role playing rules, the number should start with number 1 and not number 7.
Oh, yes.
And
Absolutely.
And we liked how you explained what a fidelity check is and how to use it.
Thank you.
And very nice detail of treatment in the fidelity checklist. In the brief annotated bibliography, you need to include data proving the results and limitation for each summary. And again, there's some formatting issues in your references also.
Okay.
For the training acceptability tools, the sentence where it says the tools serve to help improve training so our client benefits and treatment effectiveness is maximized. the last part of the sentence is a little confusing, and you would consider rewording it. And great job with the training group feedback. It included all areas of the training that feedback would be needed on. And excellent job with the individual trainer feedback. It was detailed and covered all the areas.
Yeah.
For the PSI feedback, we were not able to get slides 16 and 31 to play.
Were those
on
the
your
videos?
PSI. Yes, the video clips. Yep.
Oh, okay. So, because I thought that we had figured out a way to embed the videos, maybe we'll just provide a link to them that will be an external link. Maybe that'll work. Thank you for catching that.
And we would add a few additional slides and assessments specific to using the full DRL procedure that you're teaching on the
Okay.
PSI.
Yeah, that sounds.
And all the assessments were functioning properly, and we like the visuals that you used, and we like how you added the notes in for the slides for the presenters. And really, really great job on your examples.
Thank you so much.
Yeah, overall, it was a really great job that you guys did on the training project.
Thank you.
Thank you.
Do you guys have any questions related to our feedback?
No, I think that the feedback you gave was very valid and valuable. And so we'll definitely consider all of it and go back and make the necessary edits. Thank you so much for both the positive and constructive feedback.
Thank you.
You're welcome.